Welcome to MedClarity. Today we'll be seeing about the histology of the thyroid gland. So, if histology of the thyroid gland is asked in university question, just initially we have to specify some of the topics. So first we'll be starting about the definition of the thyroid gland, shape of the thyroid gland, other name. If there is any interesting facts, we can specify. Gross anatomy of the thyroid gland, histology of the thyroid gland, functions of thyroid gland, finally the applied aspects. So first we will be seeing about the definition of the thyroid gland. So the thyroid gland, it's an endocrine gland which is located on the front and sides of the neck. So this thyroid gland, it is located just below the larynx. So this larynx is otherwise known as an voice box. So there's a prominence of larynx in the males, which we call it as an Adam's apple. And the shape of the thyroid gland will be butterfly shape. The other name for the thyroid gland will be glandulae thyroideae. And interesting facts about the thyroid gland, if you see, World Thyroid Day, it's celebrated on May 25th. And thyroid gland goiters are not cancers. And 90% of the thyroid nodule will be benign, only 5% will be malignant. So, previously, the thyroid patients, they have a misconception that they should not intake the brassica family vegetables like cauliflower and cabbages. So, recently they have done a research and they have given a restriction for the brassica family. They told that they can take the brassica family vegetables like cauliflower and cabbages. Surgery is required only when the goiter it causes an pressure during and swallowing. So now we will be seeing about the gross anatomy of the thyroid gland. So this gross anatomy of the thyroid gland, if you see, the thyroid gland is located just below the larynx in front and sides of the trachea. So here you can see the right lateral lobe and you can see the left lateral lobe. And between the right lateral lobe and the left lateral lobe, you can see the isthmus. And occasionally in the left lateral lobe, a lobe is present. So that lobe, we call it as a pyramidal lobe. So a connection between the pyramidal lobe and the hyoid bone or ligament is seen. So this ligament, we call it as an levator glandulae thyroideae. And here the total weight of the thyroid gland will be 20 to 30 grams. Okay. So this thyroid gland will be larger in females, which increases during the pregnancy. So coming to the histology of the thyroid gland can be stained with the hematoxylin and eosin staining. So one, we can see the low magnification of the thyroid gland. Other thing, we can see the higher magnification of the thyroid gland. So here you can see the thyroid gland, it is covered by the fibrous tissue capsule. So this capsule, it extends into the thyroid gland as a septum or the trabeculae. So this one will be the septum or trabeculae. And this septum or the trabeculae, it will be separating a thyroid gland from the parathyroid gland. So here you can see the parathyroid gland. And this trabeculae, it separates the thyroid gland into various lobules. So this various lobules entirely we call it as an thyroid follicle. And the thyroid follicle, outside it is lined by the follicular cells, and these follicular cells are lined by the cuboidal epithelium. And the entire parenchyma of the thyroid gland, it contains the homogeneous mass, a pink colored homogeneous mass. It is acidophilic, and this homogeneous mass we call it as an colloid. And between the thyroid follicle, the space is seen, which we call it as an interfollicular space. And in this interfollicular space, we can see the parafollicular cells. So here you can see the parafollicular cells. So this fibrous tissue septum, it contains the blood vessel, lymphatics and connective tissues. And in the higher magnification, we can see the higher magnification of the thyroid gland, mainly the parafollicular cells and the follicular cells. So in the parafollicular cells and the parafollicular cells, how to differentiate? So here the follicular cells, it is lined by the cuboidal epithelium, and it contains the nuclei with 1 or 2 nucleoli, and the cytoplasm will be the basophilic cytoplasm in the thyroid gland. Whereas in the parafollicular cells, you can see the pale cytoplasm in the parafollicular cells, and this pale cytoplasm will be light pink in color. So if you see, the parafollicular cells will be larger than the follicular cells. And coming to the electron microscopy of the thyroid gland. So in thyroid gland, we cannot see the parafollicular cells that much clearly in the light microscope. So in electron microscope, we can see the parafollicular cells occasionally. So coming to the electron microscopy of the thyroid gland, here what you are seeing is the colloid. And here you can see the microvilli. So this microvilli, it extends into the colloid. So this is the basement membrane, and in electron microscope we can see secretory vesicles, and here you can see the Golgi apparatus. And here you can see the lysosome, and here this thing you can see the rough endoplasmic reticulum, and below also you can see some of the secretory vesicles, and just below the gland you can see this is the basement membrane, and the occasional parafollicular cells are seen in the basement membrane. So the thyroid gland activity depends upon the cells, like the cells changes its shape according to the activity of the thyroid gland. So initially when the thyroid gland is inactive, you can see the cells are only squamous or the flattened type of cells. Squamous cells are the flattened cells, and the entire parenchyma is filled with the colloid in inactive gland. Okay, so in active thyroid gland, it is lined by the cuboidal epithelium, cuboidal cells, and if you see the colloid, you can see the scalloped colloid. And next you can see the highly active thyroid gland. So in highly active thyroid gland, it is lined by the columnar cells. And if you see the colloid, you can see the scanty colloid. So in inactive thyroid gland, the entire parenchyma is filled with the colloid and it's lined by the flattened or the squamous cells. In active thyroid gland, it is lined by the cuboidal epithelium and you can see the scalloped margin of the colloid. But in highly active thyroid gland, you can see it is follicular cells are lined by the columnar cells, columnar epithelium, and there will be very little amount of the colloid, that is in scanty colloid. Now we will be seeing about the functions of the thyroid gland. So coming to the functions of the thyroid gland. So the follicular cells which produces the thyroid hormone are decided by the TSH. This TSH will be secreted from the anterior lobe of the pituitary gland. So if you see, the iodine is very much essential for the production of the thyroid hormones. Okay, so the colloid, it produces mainly the T3 and the T4 hormones. So this T3 will be the active hormone, T4 will be the inactive hormone. So now I am going to explain about the formation of the thyroid gland. So whenever there is a lower level of the thyroid hormones in the blood, so whenever there is a decreased amount of the thyroid hormones in the blood, immediately the pituitary gland, it stimulates the thyroid stimulating hormone. So once the thyroid stimulating hormone is stimulated, this follicular cells, it synthesizes the thyroglobulin. So this thyroglobulin is present within the follicular cells. Now along with the thyroglobulin, the iodine pump is also present in the follicular cells. So this iodine pump, it's present within the follicular cells. So you can see now the iodide is present in the blood. So from the blood, the iodide enters through the iodine pump into the follicular cells. Okay. And here the iodide is oxidized into iodine. Now the thyroglobulin plus iodine, both it enters into the colloid. So in the colloid, the thyroglobulin, it combines with the iodine and it forms the iodinated thyroglobulin. So now this iodinated thyroglobulin, it binds with the T3 and T4 hormones and it remains in the inactive state. So whenever there is a thyroid hormone level becomes low in the blood, immediately the iodinated thyroglobulin, it releases the T3 and T4 thyroid hormones into the blood and it maintains the thyroid hormones in the blood. So here you can see this is the iodide which is present in the blood. And then here you can see the thyroglobulin which is present within the follicular cells. and this iodide from the blood, it enters into the follicular cells through the iodine pump. So this is the iodine pump. So through the iodine pump, the iodide enters through the iodine pump and it reaches the follicular cells. Here the iodide is oxidized into an iodine. Now this iodine and the thyroglobulin from the follicular cells, it enters into the colloid. And after entering into the colloid, the thyroglobulin, it binds with the iodine, it forms the iodinated thyroglobulin. And this iodinated thyroglobulin, it remains bounded with the T3 and T4 hormone level, and whenever the thyroid hormone level, it gets decreased in the blood, so this iodinated thyroglobulin, it releases the T3 and T4 hormone and it maintains the hormone level in the blood. So this is the main functions of the thyroid hormone. So how it gets released, the T3 and T4 hormone, how it gets released. So if you see, the thyroid gland entirely, it is surrounded by the capillaries. So this is surrounded by the capillaries. The entire thyroid follicle is surrounded by the capillaries. So this iodinated thyroglobulin, it undergoes an hydrolysis. So this iodinated thyroglobulin, it undergoes an hydrolysis by the enzyme called lysosomal proteases. After hydrolysis, the thyroid hormone, it is released into the basal lamina. So from the basal lamina, it is released into the capillaries. From the capillaries, it is released into the bloodstream. So this mechanism is the release of the thyroid hormones from the thyroid follicular cells into the bloodstream. So now coming to the applied aspects of the thyroid gland. So applied histology of the thyroid gland. So now coming to the applied histology of the thyroid gland, if T3 and T4 level is increased, the TSH will be low. So why it is low? It produces the pituitary gland, which is in the hypothalamus, it produces the negative feedback mechanism. So whenever the T3 and T4 is increased, the thyroid stimulating hormone, the TSH level will be low. So how it happens? So whenever there is an increased level of the T3 and T4, there will be a decreased level of the thyroid stimulating hormone. So this condition, we call it as an hyperthyroidism. So due to the increased secretions of the T3 and T4, what happens? There will be a increased metabolic rate and it results in hypermetabolic rate, increased metabolic rate or hypermetabolic rate. And due to this hypermetabolism, what happens? There will be a weight loss in hyperthyroid patients. Hyperthyroid patients. And along with the weight loss, patients also present with the sweating, nervousness, heat intolerance, and diarrhea. So in hypothyroidism, what happens? The thyroid releasing hormone from the hypothalamus of the pituitary gland. In the hypothalamus, pituitary gland is present. Okay. So there is a stimulation of the pituitary gland. When the pituitary gland is stimulated from the anterior lobe of the pituitary gland, the acidophil and the basophilic cells are present. So from the basophilic cells, the thyrotrope cells, it secretes the thyroid stimulating hormone. So whenever there is a decreased amount of the thyrotrope cells, there will be a decreased TSH. So whenever there is a decreased amount of TSH, there will be a inadequate secretion of T3 and T4 hormone in the follicle, thyroid follicle. So this TSH hormone always exerts a negative feedback mechanism. So whenever there is an decreased T3 and T4, there will be an increased amount of the TSH. So there is a decreased T3 and the T4 hormone along with the increased secretions of the TSH can cause an hypothyroidism. So in hypothyroid patients can present with the features like hair loss, weight gain, constipation, and cold intolerance. And coming to the papillary carcinoma. So how will you diagnose the papillary carcinoma of the thyroid gland? So we can do an histochemical analysis to diagnose the papillary carcinoma. The main enzyme involved in the papillary carcinoma will be the anti-5 nucleotidase ectoantibody enzyme. So through histochemical analysis, we can detect the anti-5 nucleotidase ectoantibody enzyme. If this ectoantibody enzyme is increased in the histochemical analysis, it indicates the papillary carcinoma. Thank you for watching.